Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence.
Hi everyone, my name is Kay Mayordomo. I am part of the older adult team of ICE Physio, and I am an outpatient physical therapist. So today we will be talking about normal pressure hydrocephalus and what to look for so you don't miss it in your patients, as this is typically a diagnosis where when it's found and it's treated, there's definitely something to be done about it. It's not the type of dimension where it's like it just keeps getting worse and worse and there's nothing to be done. Like, there's significant improvement in these patients. So we need to make sure that normal pressure hydrocephalus is on our radar. This podcast was inspired by a patient that I had that I knew that something was off. Like, it was weird. So they said that the daughter, when she came in with him for the evaluation, said that the MD confirmed that he did not have Parkinson's or any other form of dementia or Alzheimer's, but he had some symptoms that made it seem kind of Parkinsonian. He walked with a very distinct gait. He had cognitive decline, and his daughter told me on initial evaluation that he just hasn't been himself lately. So today we're going to go over what normal pressure hydrocephalus is, what the signs and symptoms are, and what we can do if we think our patient has this. So what is it? Normal pressure hydrocephalus, we're going to call it NPH throughout this podcast because it's a mouthful. That's when there is excessive cerebrospinal fluid accumulating in the brain's ventricles. So the ventricles are our fluid-filled sacs or chambers. And there are two types. Today we're going to be going over more of the idiopathic primary NPH, which has no identifiable cause usually. And this is mostly in our older adults. There's also a symptomatic secondary version that they usually have risk factors of early brain infection, hemorrhage, TBI, or radiation contributing to hydrocephalus. And this usually affects people of all ages. So the hallmark signs and symptoms of NPH are the walking and gait disturbance is usually the first to appear. So this gait disturbance is called magnetic gait. So usually what we'll see is a wide base of support. The feet are moving like they're glued to the ground. Think about a person walking on a boat, like a really tippy boat, where they feel unsteady, so they're not picking up their feet all the way to walk across the boat. Another hallmark sign and symptom is cognitive decline. So usually these patients will present with mild dementia where they are more forgetful, they have difficulty in routine activities, they have short-term memory loss and loss of daily activities. They also have slowing of thought processes, apathy, impaired planning and decision-making, reduced concentration, and changes in their personality and behavior. So in the patient that I had, I noticed that it took him a lot of extra time to follow commands. He couldn't plan his movements very well either. I remember his daughter also telling me that he just seemed different, and he just hasn't been wanting to do as much as he used to. And he needed help with activities like getting dressed and just anything he normally does. It was just so much tougher for him, and he needed a lot of cueing, and even the cueing didn't really help him. The last symptom, which usually happens later and sometimes not at all, is loss of bladder control due to detrusor overactivity. So my patient didn't have this symptom, but just because your patient doesn't have all three symptoms, that doesn't mean NPH isn't the diagnosis. So there was a Mayo Clinic study done, and only 12 of the 41 patients, the older adult patients, had all three symptoms. So these patients might have one or two of the symptoms. Still good to get them checked out if you're suspecting it. So if we're comparing this to Parkinson's, just as a review, hallmark Parkinson's symptoms are usually tremor, rigidity of movement, bradykinesia, so slowness of movement, and postural instability, so more balanced problems. Non-motor symptoms can include depression, anxiety, sleep disorders, and loss of smell. So there's definitely a little bit of a difference. Like usually our patients with Parkinson's are a little bit more stooped over and their gait disturbance looks a little different. So our role, if we suspect that our patient has normal pressure hydrocephalus, is we want to refer them back to their MD to confirm the diagnosis. Because if we can get this diagnosis confirmed, then they can get treatment. It's not just something progressive where there isn't something to be done. There is something to be done and we need to make sure we're on top of it. Usually they'll get a CT scan, but this particular imaging modality doesn't diagnose NPH on its own. An MRI, that is the imaging of choice for NPH to see structural changes. Cerebrospinal fluid flow studies and MRIs are the two things that support the diagnosis of idiopathic NPH. So normally, if your patient gets confirmed to have NPH, usually they do a shunt surgery, and gait disturbance, that symptom is usually the first to resolve post-op. Once they're all done with the shunt, sometimes there are symptoms that linger, and that's where we come in. We want to make sure we're reassessing their balance exam and just how are they moving in general. For some people, honestly, it would be great for them to come in and continue to build their strength and endurance again, especially depending on how long they had it, and make sure they have good confidence in their balance and their usual activities, and if there's anything that we need to work on. So patient education in terms of what to expect following shunt surgery, though, we want to make sure that we let them know how much improvement is expected, just so they have an idea. So gait impairment usually has an 85% improvement. Bladder disturbances have 80% improvement in the early stages and 50 to 60% in the later stages. Cognitive decline or deficits, usually 80% improvement. So team, if you get somebody on your caseload that you're unsure about after they get a negative, pretty much confirmation that they do not have Parkinson's, keep normal pressure hydrocephalus on your radar. Again, it is when there's excess cerebrospinal fluid accumulating in the brain's ventricles or fluid-filled chambers. Today, we talked more about the idiopathic version that is more common in our older adult population. The signs and symptoms include magnetic gait. So think about someone on a tippy boat who is trying not to fall over so his or her feet don't leave the ground as they try to walk across the boat. Symptom number 2, cognitive decline, where they might have short-term memory loss, have difficulty in their routine activities, decision-making, changes in behavior, and personality. The last symptom to usually show up, and sometimes it doesn't show up at all, is loss of bladder control. If you are noticing these symptoms in your patient and Parkinson's has been ruled out, please make sure you have this on your radar. And again, as rehab clinicians, we want to refer the patient back to the MD to get tested for this diagnosis, because there is treatment for this, and these hallmark signs and symptoms do improve if this is the diagnosis that they have. So if you're wanting to learn more about special populations regarding older adults, we have a couple of courses coming up. Older Adult Live is coming to Leander, Texas, June 21st to 22nd. We'll be in Bellingham, Washington, and Durango, Colorado, July 12th to 13th. Older Adult Level 1 online starts August 20th, so a little bit of time before that starts, but if you want to start planning, perfect time to start. And then Older Adult Level 2 online starts September 18th, so a little bit longer until that starts. Thank you guys for joining me today on identifying normal pressure hydrocephalus. I'll see you all soon. Bye.
Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.